Dear my friend, I'm Dr. Michael Reed, an internal medicine and integrative health specialist. For over 30 years, I've had the privilege of caring for thousands of patients here in the U.S., most of them over 50. And you know what I hear all the time? Doctor, I eat healthy, I exercise, I've even lost weight, but my blood pressure just won't go down. If that sounds familiar, this video is for you. Today, we're going to uncover 3 hidden causes of high blood pressure that even good doctors sometimes miss, plus 1 powerful mineral that can lower your blood pressure naturally, often as effectively as medication. Before we dive in, go ahead and hit that subscribe button and turn on notifications. Because sometimes just 1 small piece of information at the right moment can literally save a life. When you're doing everything right, but the numbers won't budge. I once had a patient named Linda, 63 years old. She ate clean, walked every morning, and never missed a single pill. Yet her blood pressure stayed at 150/95. After reviewing everything we discovered, the real issue wasn't stress or salt, it was her thyroid, a small gland working overtime for years. And within a few weeks of treating it, her numbers dropped to 120/78, perfectly normal. That's when I realized, not every case of high blood pressure comes from the heart. Sometimes it comes from a silent imbalance your body's been trying to tell you about. The lead foot. When the thyroid hits the gas too hard, your thyroid is a tiny butterfly-shaped gland in your neck, but it sets the pace for your entire body. When it's overactive, a condition called hyperthyroidism, it's like your body's engine is stuck on full throttle. Your heart races, your metabolism speeds up, your blood pressure rises. According to the American Thyroid Association, up to 10% of adults over 50 have thyroid issues they don't even know about. The good news, it's completely treatable through medication, radioactive iodine, or minor surgery. Once your thyroid calms down, your blood pressure often normalizes naturally. Sometimes you don't need more blood pressure meds, you just need to ease off the gas. The salt hoarder. The silent keeper of sodium. Have you ever taken 2 or 3 blood pressure medications and your numbers are still high? That could be something called primary hyperaldosteronism, also known as the salt hoarder. It happens when your adrenal glands, 2 small organs on top of your kidneys, start producing too much aldosterone, a hormone that tells your body to hold on to salt and water. The result: your blood volume increases and your pressure keeps rising no matter what you do. Typical signs: low potassium levels on blood tests, muscle weakness or cramps, high blood pressure that's hard to control. According to the Mayo Clinic, this condition accounts for 5 to 10% of resistant hypertension, and the best part, it's fully reversible with the right medication or adrenal treatment. If you're doing everything right and your blood pressure still won't budge, the problem might not be your heart. It might be your hormones. The kidney pincher. When blood flow gets choked off, your kidneys aren't just filters, they're pressure sensors that constantly monitor blood flow. When the artery feeding them becomes narrow, often from plaque buildup over decades, the kidneys panic. They think your body is dehydrated, and they flip an emergency switch, the RAAS system, renin-angiotensin-aldosterone. That system tightens blood vessels, retains salt and water, and drives blood pressure through the roof. This is called renal artery stenosis, and here's how you might spot it. A sudden spike in blood pressure for no clear reason. A whooshing sound your doctor hears in your abdomen. Kidney numbers that rise after taking ACE inhibitors, or ARBs. Fortunately, it can be diagnosed with Doppler ultrasound or CT scans and treated with stents or cholesterol management, often restoring healthy blood pressure without extra pills. If your doctor ever hears that whooshing sound, don't ignore it. That's your kidneys calling for help. Potassium, the forgotten mineral that saves lives. Now, Let's talk about the unsung hero of blood pressure, potassium. The World Health Organization recommends at least 500 milligrams of potassium a day, but the average American barely gets half that. Potassium is the mineral that balances sodium. Sodium pulls water in potassium, pushes it out through your kidneys. Without enough potassium, sodium runs the show. Your body holds on to water, your blood volume climbs, and your pressure goes up. Research from Harvard Medical School found that increasing daily potassium intake can lower systolic blood pressure by 3 to 7 points, about as much as a mild prescription drug. And here's the big picture. A 10-point drop in systolic pressure cuts your risk of a heart attack by 22% and stroke by 41%. Potassium isn't a hack, it's the foundation of a healthy cardiovascular system. How to get enough potassium without pills. Most potassium supplements only contain about 100 milligrams per pill, far too little. The real solution lies in food. Here are my go-to potassium superfoods. Avocados, over 700 milligrams per fruit. Salmon and mackerel, potassium plus omega-3s. Sweet potatoes and potatoes, natural electrolytes. Spinach, lentils, and chickpeas, packed with magnesium and fiber. Bananas and dried fruit, easy and convenient. Just add one potassium-rich food to every meal, and within 7 days you might see your blood pressure begin to shift. Magnesium, potassium's best friend. Magnesium and potassium work hand in hand. If you're low in magnesium, your cells can't absorb potassium properly, and your blood pressure may stay high even if you're eating well. Natural sources include pumpkin seeds, almonds, dark chocolate, and leafy greens. For many adults over 50, adding just a small handful of nuts daily can improve both blood pressure and sleep. Sleep, the most overlooked blood pressure medicine. According to the American Heart Association, people who sleep fewer than 6 hours per night are twice as likely to develop high blood pressure as those who sleep 7 to 8 hours. During deep sleep, cortisol drops, blood vessels relax, and your heart finally gets to rest. If you're doing everything right but staying up late, remember this: no pill can replace a good night's sleep. Deep breathing, your natural brake pedal. When stress spikes, so does blood pressure. But 1 minute of box breathing. 4 seconds in 4 seconds, hold 4 seconds out for seconds hold, activates your vagus nerve, slowing the heart and dropping blood pressure by up to 10 points. Stanford researchers call this the respiratory pacemaker effect. It's one of the simplest, fastest ways to calm your body anytime, anywhere. Walking, the body's reset button. A 15 to 20-minute walk after meals can immediately lower both blood sugar and blood pressure. Harvard studies show that daily walking can reduce the risk of chronic hypertension by up to 30%. It's not just exercise. It's medicine for your heart, your mind, and your spirit. Check your medications and caffeine habits. Certain drugs like NSAIDs, steroids. Cold medicine or birth control pills can silently raise blood pressure, and so can caffeine and alcohol, at least temporarily. If you measure your blood pressure, wait at least 30 minutes after coffee or wine for an accurate reading. The final message: blood pressure is more than a number. I want you to remember this: your blood pressure isn't your enemy, it's your messenger. Each reading is your body's way of saying, "Please take care of me differently." And that care doesn't always come from a prescription bottle. Sometimes it comes from a deeper breath, a home-cooked meal, an extra hour of rest, or a short walk after dinner. Blood pressure doesn't live in a pill. It lives in the choices you make every single day. If this video helped you, please hit subscribe and share it with someone you care about. Because health isn't built on big moments. It's built on the small choices we repeat day after day. I'll see you in the next video. Nutrient secrets to lower your blood pressure. Naturally. Stay healthy. Stay curious. Your health is your power.